You're enjoying a quiet Sunday afternoon. You bite down on a hard biscuit, and suddenly you hear a sharp crack. Or maybe you wake up at midnight with a deep, pulsing ache in your jaw. Dental emergencies never seem to align with standard office hours. And if you are over 50, you bring decades of dental history to the table. Fillings age, enamel weakens, and what starts as a minor twinge can escalate into unbearable pain in a matter of hours. In that moment of panic, you are immediately hit with two pressing questions. Where do I go right now, and how much is this going to cost me? Entering the UK dental system in 2026 means facing a massive cost difference between NHS and private emergency care. Navigating these two vastly different pricing structures requires a strict mental triage checklist. Severe pain clouds judgment. Trying to make clear medical and financial decisions while your teeth are throbbing often leads to expensive mistakes. Building a pre-planned decision tree now is the only reliable way to get fast relief without walking away with an exorbitant bill. Step 1 of that triage is identifying the threat. A true dental emergency is categorized by 3 specific symptoms: severe pain that disrupts sleep, bleeding from gums that won't stop, or visible swelling in the face. If you have a cosmetic chip, a slightly loose retainer, or minor sensitivity to cold drinks, you do not have a dental emergency. Those are issues that can and must wait for a routine appointment. This brings us to a costly misunderstanding: the hospital myth. Hospital accident and emergency departments do not employ dentists. They cannot pull a rotting tooth, they cannot fill a cavity, and they cannot glue a crown back into place. A&E departments operate under strict limits. They are equipped to handle severe facial trauma, knockout injuries, or infections so severe they cause breathing difficulties. For anything else, they will only provide basic antibiotics and pain relief. Misdiagnosing a standard toothache as a hospital-level emergency has a predictable outcome. You will sit in an A&E waiting room in agony for hours, only to be turned away and told to call a local dental clinic. To bypass the hospital entirely and secure budget-friendly urgent care, your first mandated step in the UK is to call NHS 111. They assess your symptoms and direct you to the nearest open clinic. Baseline entry costs for NHS versus private emergency dental care in England for 2026. On the NHS side, a Band 1 emergency triage costs £26.80. If you need a simple extraction or temporary repair, that moves to a Band 2 charge of £73.50. But protecting your budget requires patience. The primary drawback of the NHS route is time. Once you enter the system, you will likely wait 24 to 48 hours to actually sit in a dentist chair. The private emergency pathway offers the exact opposite experience. Its defining advantage is speed, offering same-day appointments and dedicated out-of-hours availability. That speed carries a heavy financial penalty. A private emergency consultation starts between £50 and £150. If you need them on evenings or weekends, expect an out-of-hours surcharge of up to £100 before any actual treatment begins. Let's look at how that scales for a common procedure like a single tooth extraction. The absolute maximum you pay on the NHS is capped at £73.50. Privately, a complex extraction can reach £350, a steep gap of nearly £280. The modern UK system forces a blunt calculation. You trade time for money. You either endure the pain for up to 2 days to protect your savings, or you pay a massive premium to sleep soundly tonight. That calculation gets more complicated as we age. Biology inherently alters the emergency timeline, introducing specific risks for adults over 50. Take a look at this medical cross-section of an aging tooth. Notice the receding gum lines. These expose soft, highly sensitive roots to immediate decay. Above that, years of wear leave the outer enamel brittle, meaning a simple fall or a hard piece of food causes sudden fractures. Add in common blood pressure or osteoporosis medications, and your body's ability to heal after an injury slows down entirely. This flowchart illustrates the hidden financial danger of toughing it out. Delaying care allows an infection to spread. What starts as a simple £73 NHS filling compounds into a £500 root canal. If the tooth ultimately rots and requires extraction, replacing it with a private implant will cost you up to £3,000. The most effective financial defense is preventative maintenance. Strengthening your enamel with fluoride toothpaste, using a night guard to stop stress grinding fractures, and maintaining routine checkups catches decay before it reaches the nerve. Take a moment today to save your local dentist's out-of-hours number in your phone, alongside NHS 111. Having those contacts ready bypasses the panic of a midnight search. The ultimate cost of a dental emergency is rarely the immediate procedure. It is the price of hesitation. Understanding your triage options and acting quickly stops a minor ache from draining your retirement savings.